PowerPoint that we're going to do. And for social justice, I'm going to find a different definition for that. But in the textbook, it is a core value in nursing. And as nurses, we need to facilitate humanization. And then also I'm going to do something about the American Nurse Association statement on social justice. And somehow a little bit about policy. But the main thing I enjoyed in the text was chapter 7, community-based collaborative action research, and it's giving birth to emancipatory knowing. And basically what this means is that the nurse is working at the community level to create a mutuality and a trust to ensure equity is present at all times in the community and that people have access to everything that they're supposed to have access to. It provides a dialogue for patterns and how to change patterns and how to help with obesity in the community. And that's one thing I really liked, and it kind of breaks it down into steps. I was thinking about putting those steps like as a graphic in the slide, and then of course readdress the disparity here in Texas, because as we know that the people who Latin Americans and then also African Americans are #1 for obesity in the state of Texas, and the people who live in the rural areas are higher than those in the suburban areas. So I was just going to briefly, I'm sorry, I got my cat. Briefly just kind of go over those in bullet points in the PowerPoint, but then talk about it in real life at the presentation.
Mm-hmm. Yeah, I think that sounds good. And then you said you looked at chapter 7 for a good chunk of that?
Yeah, I really like it because in chapter 7 on page 96 and 97, it says that nursing is a commitment to human rights and social justice. To create healthy communities, healthy society, it's morally bound and it's marginalized periphery so that everybody has the common good for all. So it entrusts justice and equity, which are core principles for ethics, and nursing is based upon social ethics as well.
Mm-hmm.
So anyway, I think personally is chapter 7 is the best chapter to address for obesity, because it will help bring about uncovering bias and bring systems advantage versus disadvantage, solidarity with poor people, because that's usually who's more obese, because the more educated you are, supposedly the less obese you are.
Sure.
And then it will also help with the disenfranchised. And in Texas, we've got huge pockets of disenfranchised populations that still exist, and it's really bad here. We also have food deserts in the forest areas here, even around where I live in Fort Worth. None of them have accessible grocery stores. They just have really bad junk food marts, and all they sell is alcohol and junk food.
Oh, wow.
So even here in Fort Worth, we've got a huge population of obesity because of that.
Okay.
So some of that also has to do with chapter 19 as well. And so, like I said, I'm not through with chapter 19. I'm kind of I skimmed it, and then I'm going to sit down and read through it again, and we can talk about it more. But that has in chapter 19, it has more to do with, let me go back to it. Structure, environmental, golly, sorry,
no, I like that.
I'm going to try and get to it.
The colonial aspect of keeping people segregated. And I thought that was interesting because that's kind of what we're doing even today with the food marts and lack of access to grocery stores.
Mm-hmm.
So I do think that it fits in with that.
I think, not only lack of access to the grocery stores, but also like how big of access there is to cheap, bad for you foods like McDonald's, like there's McDonald's and all those places everywhere. So even not only is there lack of access to the grocery stores for the healthy food, but there's also too much sometimes access to some of the fast food places that sell things super cheap. And
yeah, that's very true.
Yeah.
Mm-hmm.
So it's very expensive to eat healthy. It's much easier and more and cheaper to eat poorly, which is terrible because the obesity problem is in our really prevalent in our lower income population. And that is our Medicaid population.
For sure. For sure. Actually, today my older sister just moved back from Vegas, and she got a job today. And I asked my mom if she got any benefits at her job. And my mom said, yeah, she gets a free pizza every day she works. And I was like, well, that sounds really unhealthy. Like, why don't they give you like a gym membership or insurance or something?
Oh, no kidding.
Yeah, that's
I mean,
interesting.
It's just like, I understand they're a food place, so like that's what they have, but I'm just like, wow, a free pizza every shift you work. Like, how many calories are in pizza? It's just, yeah. So I just thought that was really interesting too. That I was like, that's the one benefit that she gets as a manager there was a free pizza. So
wait, I was going to screen share this fact sheet and ask you guys if you had seen this in your research at all. Is that okay if I screen share for a minute?
Yeah, for sure.
Okay. Let's see if I can find it now. Okay. Can you guys see that?
Yep.
Okay. So did y'all find this fact sheet in any of your research?
I'd seen it somewhere.
Yeah, I've seen it somewhere.
Okay.
Or at least parts of things on there. Some of the things on there I've seen in other stuff too.
Some of the statistics and stuff I was thinking I would utilize from this fact sheet, mainly because it talked about the expansion status of Texas, and then the adults that are part of that expansion group, which is like 638,000, that are impacted by Texas not having adopted the expansion status of the Medicaid, the Affordable Care Act, the expansion portion of that, because a lot of states expanded coverage for certain preventative health services. And because Texas did not adopt that expansion portion of the Affordable Care Act, that's part of why we don't have Medicaid coverage for weight loss counseling specific. And so that's one of the reasons why I wanted to kind of utilize this as a reference, but also because it breaks down the percentage of the population that actually is below the federal poverty level, and then the percentage of individuals, adults falling between the ages of 19 and 64 that are covered by Medicaid. So 1 in 12 adults ages 19 to 64 are covered by Medicaid. Having that statistic available.
For sure. Do you think you could post that in our team folder or email that out to us too, so I can get a better look at that for like the conclusion part of it? And actually, I already referenced the book. I need to add that onto our. I like to do them in Word and then add them onto the PowerPoints, because otherwise they're all kind of funky looking. And so I already referenced the book, so no one worry about that. I'll do all the APAing, but then anything you guys have, if you want me to double check it. I know Nancy for sure. I know that APA is not your friend. But then of course I'd be willing to check anybody's. But if you guys want to send me your articles or post them or something so that I know where that came from to add to the list or whatever, that would be perfect.
Okay. Also, this other one too was had to do with the education level and then the household income the percentage of obese patients that fall into these categories. So I think I'm going to use those two references, and then I will, what I'll do is I'll put those in our documents for this project.
Perfect.
Okay.
Then I can kind of take a better look at them. And like I said, especially because I'm doing the conclusion, so that way I can wrap it up, but then also for that APA formatting too.
Okay.
And then, you know, and I know we're all still working on this, and, you know, we can definitely talk more through emails and everything, and next week about, you know, some of the chapters and everything that we went through. I know that that's kind of working on this week plan. But do you have anything you wanted to discuss about specifically, Nancy, with that epidemiology? Are you still kind of looking into that yet?
I'm still kind of looking into it as far as putting it into the PowerPoint. And I'm just kind of still, after reading through a little bit of the chapters, and then I'll look more. I'm going to glance through the chapter 7 that you were referring to, Margaret, too.
Me too. Yeah, me too. I'm going to look at that one too specifically.
Yeah, and then we can talk a little bit more next week, like you said, when we get together and discuss the chapters.
Just real quick, did you guys want me to address a day model for social justice, or did you want me to find another one?
To do what, honey? Sorry, I didn't hear you.
Yeah, the a day model. I don't know how you say their name.
Oh, there it is. Okay.
The model for social justice and vulnerability.
Yeah, I mean, that would be good. And then I know that in my conclusion, I was looking up stuff because it said in the rubric for me to address the Milstead process again. So, so I have to do that. So maybe if you did that on yours, and then I will do the Milstead process for, you know, kind of wrapping up the entire project and stuff on that.
Okay. So my part is only like 1 to 2 slides, and you know, I just have a brief outline of stuff that I threw down there as I was reading the text and stuff. So I will clean it all up and put a few graphics, and then I'll write my thing in the notes. Is that where you want me to put it? Yeah,
I think that worked really well last time. You know, because then we can all kind of see it, know where to, you know, and we have. This is where, Margaret, we won't be as behind, since like last time I had to keep re-recording because we had too much information, where this time we get up to 25 minutes for their presentation. So that's nice. So hopefully we won't get crazy with that, because I kind of felt bad like cutting some of that information because I felt like it was really good.
You did. It was good.
So
yeah, it was good.
So, well, thanks. I felt bad cutting it. And of course, you guys know that I'll go through before, you know, before we present, when we're all decided we're done. And I'll, and if you guys want to add pictures in too, great. But I'll otherwise touch it up, add some pictures, add some, you know, some effects and stuff that'll show during the presentation too, you know, of course, too. So that's why right now I just kind of have it blank until we.
Yeah. So we'll try to have all my stuff done by Friday. I'm hoping, or even, you know, by middle of next week, okay?
Sure, yeah. I'm hoping to kind of, I know the conclusion I won't be able to do until like the end part of next week and stuff, just because, you know, we'll be wrapping things up, or at least like the middle of next week after we meet on Tuesday. And then the winners section is the other one, that winners and losers one and stuff. And like, and so that one, I think we'll kind of, I'll probably wait a little bit on that too, to kind of see what direction we kind of are going above with like the solutions and stuff from Kathleen's portion. And then same with yours, Margaret. I think a lot of mine's is going to kind of play off of what is kind of decided above, but I have both those weekends off right before this coming weekend and the following weekend off before we present. So I can definitely get that done for us to review through before we do everything. But I think some of mine's going to be an ending result. So I'm trying to do, so as much as you guys have of your citations and stuff, if you want to send me those, and I'll gradually work on those. Like I said, I already did the reference to the book. I just haven't added it on there because it's just so much easier if I do it at the end. And then I do see that Kathleen has done some work too on the PowerPoint. She's still working too, obviously, on the solutions, but you know, so it looks like she has some ideas about like Medicaid and the weight loss reimbursement and some things that she wants to talk about with that. So then we can talk about that with her when she's available next time. So are we still thinking Tuesday then for the next meeting with them? And then of course we can do some emails about like the chapters and stuff in between.
Sure.
I think Tuesday. Yeah, I like Tuesdays.
Okay, so still like that 7:30-ish time, and I can do the recording again.
Yeah.
For that.
Does that work for you guys?
Yeah. Usually works for me.
I'm good.
Okay.
Yeah, usually works for me. Like I said, I'm on call Tuesday nights for phones. You know, usually I can get the docs to cover deliveries, but in the event that like someone calls me with the phones, like I might have to step away for 2 seconds. But otherwise, yeah, that always seems to work good for me. So I think we have a good jump. I think Margaret did great looking at that chapter 7. So I'm going to definitely look at that. And then we can kind of talk about other chapters we want to incorporate and, you know, email each other regarding those. And again, discuss those on next Tuesday a little more in depth. The
other chapter that I liked was number 1.
Okay, chapter 1.
Yeah, because it's social justice discourses in nursing. And it was philosophizing social justice as it says dialectical, but like basic conversation of how we really address health disparities and social inequities.
I think that's the only, you know, one so far I really like skimmed through was like the first chapter, the social justice, and so it's kind of what the class was about. And since we hadn't fully decided which route we were going, but yeah, and then is there any ones that you guys specifically look through? And I'll obviously look through again too, and can talk with Kathleen. But is there any one specifically you guys thought besides those ones that would be good for maybe me to add my 2 cents in and look at to help our project?
You could look at chapter 18, facilitating humanization.
Okay, I'll take a look.
Liberating the profession of nursing from institutional confinement. I really feel like nurses are that's why we're such a trusted profession, is because we're non-judgmental and we take care of people at all areas of life, and our interaction is more intimate. Being a nurse practitioner, I think that's why they why we're such change agents, but we're not in the mix per se. So chapter 18.
Yeah, I think that's a great idea. I definitely feel like you can notice that. I don't know about you all, but I get some PA students, and you know, there's some great PAs out there and stuff, but then like you can tell that some of them are so awkward with patients because like we have the nursing experience and like communication, and some of them like they just do not know how to talk, you know. And so I do think that that's a big part and a big difference, Margaret, like you said, about we have that understanding, that non-judgmental, you know, and just that that attitude to kind of take it in and kind of problem solve with the patient and stuff, and say things in a sensitive way, and that's something that not every profession in medicine is gifted with, for sure.
Yeah. And I think with our focus on, I think the nursing focus on promoting health and preventing, you know, problems, and especially with our topic in particular, the nursing profession is, it's a great tool. We're great resources for impacting this area in particular, because weight loss is preventative health maintenance, and so we're great change agents in that department.
For sure, and it's definitely a sensitive area, you know.
Yes.
So it's kind of a sensitive area, and like some people, they don't know all the options that there's even available, like to help them and stuff. Sometimes they just like, well, this is the way I've always been. So, you know, there's definitely, I don't know that a lot of our doctors actually talk to patients that come in that are like their annuals that are obese and stuff, and talk to them about, you know, weight loss.
Well, I think the biggest thing that I hear, because I'm in charge of our weight loss counseling and weight loss program at our clinic, And I think the thing that I see is that most physicians will come in and they'll go, yes, weight loss is important, improve your diet, do this and this. But what it doesn't do is actually help the patient through the process.
Mhm.
And I think that's the benefit of weight loss specific counseling, is being able to connect with the patient,
Mhm.
which, like we talked about, nursing as a profession, we have a tendency to be more connected to the patients,
Mhm.
communication wise. And
Mhm.
so I think that the weight loss counseling aspect of it is kind of falls right into our lap as far as being better people to handle that aspect of care, rather than just telling someone, hey, yeah, losing weight is going to benefit you in the long run and you need to do it.
Mhm. That's one thing. I don't know if I told you guys, but we actually at my office have a weight loss counselor. We have like the full like
Oh,
scale
that's
that
great.
does like the BMI and all that stuff, and like you know, some crazy scale. I don't get on it, but and then we have a whole entire program that they can go through with like different meal plans and packages and stuff. We do like biggest loser contests, and so like patients that are in that, they can do like a biggest loser contest and then get gift cards, because we also have like beauty products and stuff at our office. Like, I mean, we do Botox and like dermaplaning and hydrofacials and all that stuff. And so like, if they win, they can get a free hydrofacial or, you know, something like that. And
Oh my gosh.
And so like, sometimes I get irritated with some of the docs, because I'm like, we have so many resources here, you know, like, and like, we'll talk with them. We give them out patients that want to do weight loss and stuff. We have gift cards that they can go, we can give them a free month at the YMCA for them to go to the YMCA for free for a month. I mean, like, we have, like, literally our office has it set up, and the doctors still don't utilize it. Like, they're
And
just
they don't
Oh,
do
wow.
it.
they're like, you should lose weight, you know, like, or obviously your blood pressure will come down if you lose weight. But I'm like, no,
Yeah.
like, talk to them about this and about how there's struggles, there's ups and downs with it. Stress can cause weight, you know, like,
Right.
give them the gift card to go to the YMCA to get them started, you know, let them be weighed with Kayla and like our weight loss counselor, let them come back and like, you know, show what areas of their body has changed. Like, we really do have it all set up, and still it's not always utilized, which is really sad.
Yeah.
And we have it all there. Like, we are literally, for an OB office, we are a one-stop shop. Like, we have everything in our office.
That's great. We're just GYN, and we don't, I mean, we're just kind of starting off our weight loss program and that aspect of it. And I'm going to be the one to oversee it. So I'm going to have to call you independently and pick your brain on some things. Those are some great resources and some great techniques for motivating people. But
super great. They have so many things. Like I said, even like they got a big deal and then like promotional stuff from the YMCA for them giving us like, you know, and sending patients there, and then like them keeping patients, because after their month, they're like, oh yeah, I'm seeing some results. And then they, you know, want to keep going. And like, I mean, there's so many things. And so we're really fortunate, because we have like counseling, we have beauty stuff. Like we have, we have so much stuff. We have a family nurse practitioner that does all of our diabetes counseling and stuff like that. Like, we are super set up for an OB/GYN office. So, but like, just to let you guys know that still you can have all those things, and still sometimes it's not utilized the way it should be. So
you can lead a horse to water, but you can't make him drink.
Exactly. It's just, the difference, you know, and part of that is, you know, part of our job as nurses is education, and that's where we obviously are known to do more than that, or more of that, as, you know, APRNs and nurses. So, but
exactly.
Oh yeah.
Yeah, but so it's just kind of crazy. But otherwise, is there anything else you guys are thinking? I know Margaret's kind of going to work through things, and obviously all of us will. Kathleen has some stuff on there, and I know she'll be meeting with us next time. I'll definitely take a look at this chapter 18, and then kind of go off of what you guys have for kind of trying to start that conclusion process and that Milstead process, and then winners and losers part of it, and doing that part and the APAing. If you guys just want to send me your references or the articles or post them so that I can help you with those. But is there anything else we need to address today, you think?
No, I think we're good. I was looking at, I read through chapter 5 already, and I was looking at chapter 19. Is there a, Margaret, since you're more familiar, is there any recommendations on the book that you think
for what?
Outside of that?
On chapter 19?
I looked at I just wanted to know, do you think that other chapters after your reading, because I know you took advantage of reading the book, that you think might be more beneficial?
I felt that chapter 19 was more for about I mean, it's good too. It's
okay.
We're
gonna have to. We can get together and talk about it. So.
Mm-hmm.
You do what?
But women are also, some women are kept across here too, so we can even address that if you wanted. But I think it's more about that's what I take out of it.
Mm-hmm.
Okay.
Yeah, and I'll look at chapter 18, and then I'm going to look and see if there's anything that'll kind of address, that whole winners and losers portion of, which I think obviously part of that's going to be, with the solution where, biggest solution is going to be the reimbursement for the weight loss office and stuff. And then for the, who gains, what are the costs of the potential solutions and stuff. It's also part of the winners, losers and stuff. And so obviously it's going to be the payment of Medicaid and some of that stuff. So I know that I'm going to put some of that on there, but I think there's probably more stuff I could probably incorporate that I could find in the book about that section too. So I'll kind of skim through some other ones about that too.
Yeah, and chapter 5, I liked it too because it talks about also the walls and permeability versus illusion, building walls around certain social contexts and how we still isolate people, kind of more along the colonial point of view, but it also is just, some people are completely obscure. They don't realize what's actually happening outside in the real world.
Mm-hmm. Exactly.
Where nurses come in. So I did like that chapter too.
Yeah, because I think the biggest thing with the winners and losers section, it's the biggest losses is going to be that there's going to be more Medicaid payout because of the, but then at the end of the game, it's going to be lower. I mean, more Medicaid payout initially because of the counseling, but then in the long-term goal is trying to show the effects that yes, but now people's aren't having diabetes or type 2 diabetes, or not having hypertension, or, not as what they were, and that's going to be where the gains are. And, also probably in my section too, how you talked about, Margaret, the, African-Americans in the rural area and those kind of things are going to be also who, has some of those gains more than most because they're who are having those problems. And then you even, Nancy, had some of those statistics too about the ages and stuff. And so I think that can also kind of play into mine, my section as well.
Well, and you got to keep in mind too that Medicaid has limited resources. So to give to one, you'll have to take from another, as far as the Medicaid programs go. So, I mean, I'm sure there'll be some impact on other programs, but like you said, long-term goal is that we have a reduction in medical expenses as a result of improved health outcomes. So,
yeah, it's going to be, and we might, what's that saying? Rob from Peter to pay Paul or something like that.
Rob from Peter to pay Paul.
But then later it all
balances out.
Balance it out, or we'll come out ahead, really, because really we know that obesity is one of the leading causes of a lot of health concerns and stuff, and that we're one of the worst countries in obesity. And so
we are.
So so I think that'll have to play an effect too. But you're right, Nancy, that's definitely, those funds have to come from somewhere. I mean, they're going somewhere now, so I'm going to have to, you know, kind of look into like what that would look like if we did take some Medicaid from, you know, money from something, or not that I necessarily have to choose who it's coming from, but it's definitely going to affect somebody. So
Yeah, especially when it costs so much money anyway for obesity.
yeah,
Billions a year
mm-hmm. For sure, for sure.
in the United States alone.
Mm-hmm.
Yeah.
Mm-hmm. For sure. It's, you know, pretty, crazy. And you're like so right too. Like I said, Nancy, like it's just crazy that it is that much more expensive to buy healthy food than to go to McDonald's. I mean, that's still like, and we all know that it's not a secret. Like you can go to the Dollar Tree and get all this junk food at the Dollar Tree and go to McDonald's, but then, you know, it's really expensive to get salad and fresh vegetables and stuff, you know?
Yeah.
And that's where too, I think she had said something about another group's project, like in the last policy, you know, but like how she had mentioned selling like fresh produce on the streets and stuff like that, or something. Do you guys remember something about that?
I do remember that.
I'm like, man, that's maybe where it's at. Like it's these grocery stores that are you know, shipping it all in and having all their stuff and then jacking up the prices. It's like, really, that's not that expensive.
No.
It's just the end result of even that's making it be that expensive because of the importing and stuff, you know. But
yeah.
So I couldn't sleep this morning, and I got up at 3. And when I was up at 3, I was listening to the United Nations live stream about the refugee crisis, and at the G10 summit, sorry. And do you know that the United Nations is spending over $20 billion to help the refugees globally?
really,
Over $20 billion to fight obesity in the United States.
mm-hmm.
And
Oh
they
my
have
gosh.
their homes, they have their food, and look at how fortunate we are.
Mm-hmm.
Yeah, it was very interesting. So they're not even focusing on obesity or that kind of thing now. The United Nations, I don't know if you've been listening, but the United Nations, you know, humanity's at a tipping point right now. And so the refugee crisis has more than 90 million people without a home, and it's growing because of climate change. In the last 3 years, more than 10 million people have been forced out of a home due to climate change.
Mm-hmm.
So something has to be done, and they're asking the world leaders to donate money for that versus other things in the world right now.
Yeah. It's really surreal sometimes when you see, you know, hear about some of that stuff or see some of that stuff, because I kind of saw some of that stuff, Margaret, on Facebook about the refugees, and then like it had like all those starving kiddos and stuff, and like showing their ribs and stuff, and how they're smashing leaves and making like a paste out of leaves. Did you see that? And I'm just like, oh my gosh, like, you know, as I'm sitting here pregnant eating my like fresh grapes and M&Ms and crackers and like in one setting.
Yeah.
It's just, you know, and sometimes I like, sometimes, you know, it's just haltering how much, you know, we think that even we deserve, and, you know, that kind of stuff, and like how much we get. And then you see those things and you're like, oh my gosh, there is people like literally living without food and clothing. And like, here I am throwing a fit because my basement bar that I'm building, that they messed up shipping my my sink to me. It went to Washington instead of me. And I was really upset about it. Like if that was my biggest problem or something. Like
I know. we have to ground ourselves every once in a while.
We do, because I literally right after that saw that video, and there's these sweet babies eating leaf paste, and I'm like, oh my gosh, Caitlin, you are just so like selfish, you know, like you're eating candy and complaining that your bar went to Washington, and this little and I'm just like, oh, we do not have it figured out. How is the world so different? I mean, how is it that different across the world? You live
Yeah.
in your own little area and you just can't even fathom that sometimes that goes on, or you forget. It's so easy to forget. You get busy and forget. That's just crazy.
It's easy to forget.
Yeah.
Mm-hmm.
Yeah, it's very sobering statistics. So
Yeah.
that was interesting.
Yeah. Yeah. That's crazy. And like you said, that it's that much money and like that's how much we're spending on obesity. Like,
Right.
Yeah.
That's what I was. Just the
Are you
just the
kidding?
severity of that alone.
wow.
Very sobering.
So crazy.
Anyway.
Well, ladies, is there anything else you guys want to go over today? I know obviously we'll email and then we'll plan a meeting next Tuesday. And then, you know, obviously we'll be seeing what each other's working on in the Google Doc. But I think we got a kind of a good start. And then Kathleen will be with us in next week, I'm assuming. So, Margaret, I know you talked to her a little bit more. Do you? We can all email out too, but would you talk to her before then? I know sometimes you guys call each other and stuff too. Would you hear
Who's
from
that?
her?
Kathleen?
Yeah.
Oh no, we just communicate through email.
Oh, is it just email? Okay. She said something last week about
Well, she texted me.
oh, maybe that's what
But
it is.
I was asleep when I woke up. I saw the text, and then I emailed everybody because I was like, "Oh crap!"
No, that's good. I'll just send out an email then and like just make sure she can still meet next Tuesday then, and then we'll just kind of gradually email and work on it then throughout the week.
Okay, sounds good.
All right.
That sounds good.
All right. Have a
All
nice
right.
See you later.
All right. Y'all have a nice night.
Good night.
Bye.
Bye.